Welcome to ASAP UA Healthcare Consultants Prometric Coaching for General Practitioners. In this session, we are going to discuss a gynecology MCQ. A 30-year-old woman presents to the physician with a grayish foul-smelling discharge. A saline wet mount examination reveals numerous epithelial cells coated with the bacteria. Which of the following is the most likely diagnosis? The options are bacterial vaginosis, trichomoniasis, and candidiasis. First, let us have some idea about the normal vaginal defense. We know that the vagina is lined by stratified squamous epithelium, and the normal pH of vagina ranges between 3.8 to 4.5. This acidic pH of vaginal secretions serves as the normal vaginal defense. So, why is the pH acidic? This is because the estrogen promotes glycogen synthesis, and this glycogen is used up by the lactobacilli, which is the normal flora present in the vagina, and they produce lactic acid. This lactic acid is responsible for the acidic pH of vagina. Bacterial vaginosis is the most common vaginitis seen in reproductive age group. It is not a sexually transmitted disease. Here, there is abnormal growth of vaginal flora where the lactobacillus is replaced by Gardnerella vaginalis. The predisposing factor is repeated alkalinization of vagina, and it occurs when there is multiple sexual partners and multiple sexual intercourses, etc. Now, how do we diagnose bacterial vaginosis? It is based on a criteria called Amsel's criteria, where presence of 3 out of 4 criteria is diagnostic. This includes foul-smelling grey-white vaginal discharge, pH of vaginal discharge more than 4.5, the wet smear shows clue cells, and whiff test or KOH test gives a characteristic fishy smell. Clue cells are those vaginal epithelial cells which are coated by numerous bacteria. Moving on to our next topic, candidiasis. It is mainly caused by Candida albicans. It mainly occurs in those people who are immunocompromised like HIV patients or patients who are under prolonged antibiotic use or pregnant women or diabetics. The patients presents with curdy white vaginal discharge, often referred as cottage cheese discharge, and also she may have intense itching and dysuria. The vaginal pH here is less than 4.5, and the investigation of choice includes wet smear which shows a fungal hyphae along with WBCs. Patients are often treated with oral fluconazole, or the other options include vaginal tabs or pessaries of clotrimazole, miconazole, or ketoconazole. Moving on to trichomoniasis, it is a sexually transmitted disease caused by Trichomonas vaginalis. The symptoms includes greenish, thin, frothy discharge, and the patient also complains of pruritus, dysuria. The vaginal pH here is more than 4.5, and on speculum examination we may see a strawberry cervix as shown in the figure. Here also wet smear is the investigation of choice. And what do we see in wet smear? There will be tennis racket appearing flagellated parasites along with WBCs. The treatment includes metronidazole, and here the sexual partner should also be treated. Now, this is a table summarizing what all we have discussed so far in this session. So, doctors, please be thorough with this table because this is a very important topic which is repeatedly asked in the Prometric exams. Now, let's get back to the question. So, here a 30-year-old woman is presenting with a greyish foul-smelling discharge, and a saline wet mount examination reveals numerous epithelial cells coated with bacteria. What is the most likely diagnosis? So now we know that a greyish foul-smelling discharge is present in bacterial vaginosis, because in trichomoniasis it is greenish, thin, frothy discharge, and in candidiasis it is curdy white discharge. Also, a wet smear examination in trichomoniasis shows tennis racket shaped flagellated parasite. along with WBCs, and in Candidiasis we can see fungal hyphae along with WBCs. So the answer here is bacterial vaginosis. Thank you all for watching the video and stay tuned for our next session.